Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope Natural Health podcast, where I tried to get you healthy the right way. Last week, I had a very special guest with me, Dr. Laura, and we talked all about your brain and stress. So if you missed that, go back and check it out. But this week, I want to talk more about why routine exams matter. And I know I've touched on the subject briefly, but I figured I'd devote a whole podcast episode to this because you really don't need to be sick to go to the doctor. And if you know me and my history, I'm a huge example of this. And things just happened to go awry in my body, and I wasn't sick. I just did routine exams, and I found a lot of things that were detected early, and early detection really does save lives. And you have to get your routine exams done to know this. So what really consists of routine exams? Well, it's anything from regular blood pressure checks to lab work that includes your blood sugar, kidney function, liver function, your inflammation, your hormones, your thyroid, your adrenals, making sure that you get a comprehensive look at the insides as far as your labs go. And then there's also various screening exams that need to be done. Now, most of these screening exams don't start until we're, later on in life or in our 20s and above, but they are super, super important to do regardless if you want to do them or not. I think that's a big thing, is that a lot of men and women really just don't want to do them because they think that they're healthy. And I'm sorry to tell you, but you really need to do them because this is where we can find things early and detect it early, so that way nothing will get worse if you don't take care of it early. So the first one we're going to talk about is Pap Smears. So that's the cervical cancer screening for women. Basically, it starts when you're about 21 up until about 65 years of age. So this is super, super important part of women's healthcare, and it's something that I actually do in the office. So I do well women's exams here, and you don't need to be a primary care patient to get your well women's exam. You can just make an appointment for that. But you should start at screening at age 21, regardless if you have had intercourse or not. So how often you need to get the cervical cancer screening really depends on your age and your health history moving forward. So women who are 21 to 29 should have a Pap test really now every 3 years. And we need to add on HPV testing for women who are 25 to 29. But before that, typically just a Pap is done. It's kind of questionable. My personal opinion is if you've started to have intercourse earlier, I think the Pap or the HPV testing should be done earlier than 25. But these are the guidelines. I'm going to read them. And this is coming from the American College of Obstetrics and Gynecology. And women who are 30 to 65 really have 3 options for testing, which makes it really confusing. So that's why you have me in your life to help you. But you can have a Pap test and an HPV testing every 5 years, which I think is ridiculous. That's way too short or too long of time. Or you can have a Pap test every 3 years, or you can have an HPV test by itself every 5 years. So I recommend doing the Pap and the HPV testing every 3 years. Personally, with my personal history, I do it more frequently than that. And I really think it's up to you and your body what you're comfortable with doing. We also will test for common STDs like chlamydia, gonorrhea, for sexually active women who are 24 and younger, or older women with an increased risk, or if you have any concern for sexually transmitted infections, we can test those really at any time. A lot of that testing now can be done via the urine, so you don't have to have a speculum exam to test those. So keep that in mind. I also do STD testing in the office. Mammograms, big one. These guidelines literally are all over the place depending on who you talk to. So we have the U.S. Preventative Services Task Force. We have the American Cancer Society. We have the American College of Obstetrics and Gynecology. We have the International Agency for Research on Cancer. We have the American College of Radiology, the American College of Physicians. And then the American Academy of Family Physicians, they literally say a different thing. So basically, when you turn 40 years old, this is when you should start having your screening mammogram. Now, in my example, I probably wish I would have started earlier. And I think those that are at super high risk with like family history, moms that have had breast cancer, sisters, etc., should, I think, start screening earlier. But this is what insurance will pay for if you have insurance. But remember, you're the advocate for your own health. And I'm going to do a whole nother episode on my whole breast saga. If you've been following me on social media, by the time this podcast airs, a lot probably has been developed, but we'll do a whole podcast on that. But I started mammography at age 40, was told that I had dense breasts, needed MRIs, plus I'm also very high risk for breast cancer due to my mom's history and also my past history of non-Hodgkin's lymphoma. So again, you have to take this with, your risk factors, but for average risk, it's recommended to start the screening mammography around at age 40 up to 49, if you're at average risk. And then usually a radiologist will determine if you need further follow-up imaging, perhaps diagnostic mammograms, followed by possibly an ultrasound, and then maybe an MRI for further diagnosis. So that's really up to the radiologist at that point, but we usually start with the screening mammography. Women ages 50 to 74, still, again, we want to do the mammography. They say once every 2 years. Other, guidelines say every year. It really honestly depends. I am a huge, huge, huge advocate for at least once yearly, depending on you and your risk factors. So after 75, typically they say there's no real benefits to doing the mammography. And then women with the dense breast tissue, usually they'll add in other imaging, whether that's an ultrasound and or an MRI to look further, because sometimes dense breast tissue can hide things. So we have to take a different look at it. So those are kind of the cliff notes on the mammography. The next one we want to talk about is colonoscopy, and this is for men and women. So the American Cancer Society recommends that people at average risk of colorectal cancer start regular screening now at age 45. These guidelines really changed recently. So it used to be 50, now it's 45. And this can be done via a stool test or with an exam, which is the visual exam, and that's the colonoscopy. So usually you should have to do this once every 10 years, and it kind of stops about 75. So those individuals 76 through 85, it's really determined if your lifestyle, your history, overall health, etc. And then it's not really recommended for those over 85 anymore. So if you're 45, time to get the colon checked. My podcast with Carrie V would be a good one to listen to about colorectal cancer. That's episode 32. So go back and look at that one, because she is, they found colorectal cancer on a routine colonoscopy. So a good one to check out. Another important exam that you should do every single year is your skin check. Go see your local dermatologist for your skin check. There's a lot of things that can start to develop on our skin, and caught early can really avoid, worsening condition. And I'm another prime example of this one. By doing routine skin exams, they were able to find very, very early stage malignant melanoma. And I talked all about my skin saga in episode 40. So go back and listen to that if you want to hear about my skin cancer diagnosis recently. And then the last one we'll talk about is prostate exams. And this is another one specific for men. So men ages 45 to 49 should have a baseline prostate-specific antigen test, which is typically a blood test. And if your PSA level is 3 or higher, you really need to speak with your physician about having a possible biopsy of the prostate. And if it's between 1 and 3, you should see your doctor for another prostate test every 2 to 4 years. So a lot of physicians do the digital rectal exam where they'll feel the prostate to make sure that it's, appropriate texture and feel and size. You can tell that. Some doctors don't. So it's really up to your your men's doctor or your primary care physician, for you men out there listening, about your prostate exam, but you really should get your PSA levels tested early so we can track that. That's a really good risk factor for prostate cancer. So I probably will spend most of this year advocating for routine labs, just with what I've gone through the first few months here of 2020 with the skin cancer diagnosis and now the precancerous nodule that's in my breast. That will be addressed here soon, and probably by the time this podcast episodes, it might already be addressed, but we will have another one on that. So again, I thank you all for listening. I hope you learned something, and hopefully you'll get off this podcast and make your call to either your gynecologist, your primary care physician, your dermatologist, your gastroenterologist, or maybe me, if you're in the Phoenix area for your routine exams. I'd be happy to help. Happy to help you with your health is what I wanted to stumble out there. So again, thank you all for listening, and we'll see you again next week.